appropriate timely intervention is the responsibility of the caring nurse. So it is vital that the nurses have a clear insight into the practical aspects. Intervention. I think the quiz program will enhance their knowledge and make them smarter to handle any emergencies in the ICU. So this program definitely will show them the right right pathway to improve their knowledge and their practical skills. So definitely NNF will continue such programs in the days ahead. I am glad that everybody, including Dr. V.C. Manoj and Rajagopal and all the quiz masters are here to participate in this program. I wish the program all success, and I am glad to inaugurate the quiz program on behalf of NNF Kerala. Thank you. Jai Hind, Jai NNF.
Thank you, Devi sir, for your kind words. Now I request Dr. Manoj VC to address the gathering.
Thank you, Raj. Respected seniors and my dear friends, NNF Nurses Quiz is one of the events that is always awaited with much mostly because of the academic content and the intense participation that it generates at all levels. Today we have the North Kerala divisional round, which is being held ably coordinated by Dr. Phoebe Francis and then conducted by Phoebe and Dr. Nitya. I'm sure the session is going to be very interesting for all of us to watch. So those of you join, hearty welcome. Enjoy. My only message to the contestants is the participation itself is the biggest gift that you can have in any competition, and this is a matter of your, and it tests your luck as well as your knowledge. So the luck factor is there. So enjoy the whole event. Whether you win or not, you are anyway a winner by participating in this. So congratulations to all the teams for having reached this level of divisional quiz participants, and let's see how it goes. Thank you.
Thank you, Dr. Manoj VC. Secretary of State, Dr. Nelby is also here with us. I request him to address the gathering. Unmute.
Good evening, everyone. It's a pleasure to watch everyone enthusiastically waiting for the quiz to start. As Dr. Manoj was saying, it's always the participation part is much more important than winning. That enthusiasm, that learning, the eagerness to learn. As Revisa was always mentioning, this basic knowledge, and our eyes will see only what we know. That is the thing. So we should have a basic knowledge. That's what we expect from all the staffs. And any NICU, it's run by the staff only. The doctors just visit the NICUs. It is basically run all. If you say an NICU is a good NICU, that means the staff there are the best staff. So like that, this is a learning experience. You are all learning from these quizzes, everyone. So wish everyone a best of lot of luck and best of luck to all the participants. Thank you.
Thank you, Dr. Nelby. Dr. Pawan is not with us. So anyway, we'll do one thing. We will straight away move to the program. Once again, I am thankful to you all for joining the program, and I request the quiz masters, Dr. Phoebe Francis and Dr. Nitya, to take over the session. Thank you.
Thank you, sir. Thank you, Manoj sir, Revi sir, Dr. Nelby, Dr. Raj Gopal sir, for giving us this opportunity. Sir, one request, can we make all the participants as co-hosts?
Sure.
One is A, marked as A, then B, then others are team C, D, E, F.
A, B, C.
A, B, then next is team C, team D, team E,
Dr.
and F.
Manoj?
Yeah. What is the confusion?
Sir,
No.
make the teams
Co-host.
cause.
A, B, C.
Yeah, you can. No, why are they named like that? We could have.
No, they are the candidates for the quiz. They are named as A, B, C, D, E.
No, but okay, fine. Two B's are there.
So our laptop and a problem. Check the device in our login.
Okay, fine. Now, where is C?
Team C.
Team. F is also there.
Yes, sir. F is also.
All are made, no?
Yes, sir.
Raj, I'll make you host. Or
Okay.
Febi.
Febi will be anyway. They will be
Okay.
here for full time.
Febi.
Yeah, sir. Yeah, sure.
Yeah. Please go ahead.
Nitya.
Okay, ma'am. Shall I share the screen?
Yes.
I hope it's visible.
Yes.
Okay. Am I audible also, ma'am?
Yes.
Clear. Okay. So, good evening, everyone. We welcome you all to the NNF Nurses Quiz South Zone Divisional Round 2021. I thank the organizers as well as our quiz coordinator, Dr. Febi, for this opportunity. I'm indeed humbled to do this quiz in front of such an august audience. So, just in short, we had 16 teams for the prelims round. And as Manoj sir and LB sir rightly mentioned, participation itself means they have won the game. We had 16 teams. All did very well during the prelims, but since the rule is like that, we had to select 6 of them. So 6 teams, the top 6 teams were selected. And congratulations to all the participants as well as the teams who were chosen as finalists. So we have the finalists here. We have, can I get them on the screen? So you can quickly unmute and introduce yourself. Team A.
Yes, ma'am. We are from WNC TechCAD. My name is Ashwati.
DYC.
Okay. So congrats, WNC TechCAD. We'll move on to Team B.
Thank you, ma'am.
Team B. Team B, are you there? Team B. Unmute Yama.
Team B, render device unmute ചെയ്തിട്ടുണ്ട് പക്ഷെ കേൾക്കാൻ പറ്റുന്നില്ല.
Test I think they got it corrected, madam. So team B, please solve your issue. By the time we'll come back, we won't waste much time. Team C. Team C, are you there?
Good evening. We are from Kinder Hospital, Sertala. My name is Maya. I'm Rosie.
Oh, welcome to the quiz. Team D.
We are from ICH Kottayam. Myself, Anit, and Manju is there.
Okay, welcome. Team E.
We are from Medical Trust Hospital. I'm Sona. This is Shalu.
Welcome. And Team F. Team F, are you there? Team F, please unmute.
Hello.
Okay, come. Okay. Team F, I hope your internet is okay. Internet no prashna illalo, alle? Okay, please introduce yourself.
We are from Trivandrum. Myself, Ashwini. I'm Veena.
Okay. So welcome Team F. And Team B, can we come back to Team B? Team B? Team B?
BB.
Team B, Team B.
SAT Trivandrum.
Okay. Team B volume കേൾക്കുന്നില്ലല്ലോ നമുക്ക് ആൻസർ പറയണ്ടേ അപ്പം പ്ലീസ് ഗെറ്റ് ഇറ്റ് കറക്റ്റഡ് കേൾക്കുന്നുണ്ട് ലൈറ്റ് ആയിട്ട് കേൾക്കുന്നുള്ളൂ കുറച്ചും കൂടി അടുത്ത് വന്ന് പറഞ്ഞോളൂ പ്ലീസ് ഇൻട്രൊഡ്യൂസ് യുവർ സെൽഫ് ഓക്കെ ടീം ബി നമുക്ക് ഡയറക്റ്റ് ആൻസേഴ്സ് വരുമ്പം ആൻസർ പറയാനായിട്ട് ഇച്ചിരി ബുദ്ധിമുട്ടുണ്ടാവും അപ്പം നിങ്ങൾക്ക് വോളിയം അല്ല ഓഡിയോ പ്രശ്നമാവുമോ അങ്ങനെയാണെങ്കിൽ ഡിഡ് യു ട്രൈ ഫ്രം അനദർ ഡിവൈസ്
അതാണ് നമ്മൾ യൂസ് ചെയ്യുന്നത് ലാപ്പ് പറ്റുന്നില്ല മാഡം ഇപ്പം ഓഡിബിൾ അല്ലേ ഞങ്ങള്
ആണ് കുഴപ്പമില്ല അപ്പൊ ഇതേ ഇത് മെയിൻറ്റെയിൻ ചെയ്തിട്ട് ആൻസർ പറയണേ ചാറ്റ് ചെയ്യാൻ പറ്റുന്നുണ്ടല്ലോ അല്ലേ ചാറ്റ് ബോക്സ് വർക്ക് ചെയ്യുന്നതാണല്ലോ അല്ലേ
എനേബിൾ ചെയ്തില്ലല്ലോ ഡോക്ടർ ഫെബിയുടെ പേരിൽ
Okay, അപ്പോൾ എല്ലാ ടീംസും please enable the chat box. I'll come to the rules now. So as this is online quizzing, we know it's slightly difficult. നമ്മുടെ physical online quiz പോലെ അല്ല. Wi-Fi connection is very, very important. So all of you must have an uninterrupted Wi-Fi connection. All of you should keep the video on throughout the quiz. Chat box enable ചെയ്ത് വെക്കുക. Keep the entry code also ready. If at all accidental disconnection ഉണ്ടായാൽ you have to come back. അല്ലേ within maximum 3 attempts വരെ നമുക്ക് തരാം അങ്ങനെ ഉണ്ടാവാതിരിക്കട്ടെ. And then within 2-3 minutes also you have to come back. So keep the things ready. And as per the rules of quiz, it's already discussed. I'll just go through the rules quickly. 5 passing rounds under, 4 question answer round and 1 visual round, and followed by a rapid fire round. The first 3 rounds will go in the order A to F. The next 3 rounds, that is the next 2 passing rounds in the rapid fire will be in the order team F to team A. Okay, I hope it's clear. And the way of answering, it's like the principal team has to wait for 10 seconds till the others, all other 5 teams have to quickly type the answer in the chat box and send it to Dr. Febi. So all the teams are requested to enable the chat box to Dr. Febi. Febi madam's പേരിലുള്ള chat box enable ചെയ്ത് വെക്കുക അതിനകത്ത് ആൻസർ ടൈപ്പ് ചെയ്ത് you have to send it. Unmute only while answering and please be in the audible clear ആയിട്ട് loud and clear to the point ആയിട്ട് ആൻസർ ചെയ്യുക. ക്ലിയർ ആയിട്ട് ആൻസർ ചെയ്യണം ഞങ്ങൾക്ക് കേട്ട ആൻസറിനെ ഞങ്ങൾക്ക് പോയിന്റ് തരാൻ പറ്റുള്ളൂ കേട്ടോ and of course audience is a big part of the quiz plus please stay muted. We have quite a few audience questions as well, and as in any other quiz master's decision is final. അപ്പോൾ എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടോ? I think we'll move on to the quiz. Okay, so please be ready with the chat box and a good audio system. Mic ready ആക്കി വെക്കുക. Please don't get disconnected in between. So madam, shall I start?
Yes.
Okay, so this is the first round. We have the basic neonatology round first. We have question to team A. Team A ready now? Can they please unmute and say yes?
Yes, ma'am.
Okay, good. And other teams be ready with the chat box. This is your question. The picture shown here shows a distribution of a particular type of fat in term newborns. What is it called and what is its function? Time starts now. Quickly type, team A please wait. Quickly type, others quickly type what is the fat called and what is its function. Okay, time up. Febi madam on the chat box nokamo. Did you get the answers?
Yeah, I got B and D's answers.
Okay, fine. I think no more answers. So if you don't have any answer, you can send N so that we can continue with the quiz. Okay, answer illengi appo thanne N type
Okay,
ചെയ്തു വിടാം.
C and F also.
Okay, fine. So team A can answer now.
Brown fat, thermal regulation.
Okay, very good. So I think I should give 10 points to team A. In between, I'm sorry, I forgot to introduce Dr. Namita, who's our scorer. Namita, are you there?
Yes, madam.
Okay, yeah. So Namita, please take note of this. We have 10 points to team A. So other answers will not be valid here because team A has already answered. Can I ask team A anything extra? What type of thermal regulation do you expect with brown fat?
Non-shivering thermogenesis.
Wonderful. So they know it. Very good. So 10 points to team A. And I hope all other answers are also correct. Alle, madam?
Yes, yes.
Okay. So it is brown fat with non-shivering thermogenesis. Very good. So we'll move on to the next question. Team B, are you ready?
Yes, ma'am.
Okay. So here is your question. Others can type the answers and send it to Dr. Febi. Regarding kangaroo mother care, what are the 3 components? Quickly type 3 components. Just a short form is enough. 3 components. What are the 3 components of kangaroo mother care? Time up. Ma'am, can you please see if you got the answer? If you don't have answer, please type N and send. Okay. Can I request the audience to please stay muted? Okay, madam, did you get the answers? And
1 minute. Yeah.
okay.
Okay, I got the answers.
Okay, team B can answer now.
Breastfeeding, skin-to-skin contact, or discharge.
Team B, please be loud.
Breastfeeding,
Okay.
skin-to-skin contact, or discharge.
And discharge. Okay, so they got it right. So there are 3 components as they have rightly mentioned. So 10 points to team B. Nimita, please note 10 points to team B. So it is breastfeeding or nutrition, kangaroo nutrition, skin to skin contact, kangaroo position, and kangaroo discharge, discharge and regular follow-up. Okay, 10 points to team B. I would tell the team B's voice is very, very feeble. We have to struggle to hear you actually. So either find any other alternative or come a little more closer to the device and answer. Okay. The next question to team C. Are you ready? Team C, can I say hear a yes from you?
Yes, ma'am.
Okay, good. So here is your question. Others be ready with the chat box. This is your question. What is the wavelength of the light spectrum where phototherapy is the most effective for treating neonatal jaundice? Time starts now. Please wait for 10 seconds. Others will quickly type the answer and send it to Dr. Febi. Time up. Madam, did you get the answers?
Yes.
Okay, so team C can answer now.
430 to 490 nm, and it is most effective in irradiance of 30.
Okay. 430 to 490 you mentioned, is it?
Yes, sir.
Okay, I think we can give it to them, madam?
Yes.
Okay, so very good. So 10 points to team C as well. This looks like a high scoring quiz, madam. Okay, very good. So we'll move on to the next question. Are you ready?
Yes, ma'am. Yes, sir.
This shows the answer. 460 to 490 to maximum, as you have mentioned, the blue-green spectrum. So I won't go into the details. Team B ready now?
Yes,
Team
ma'am.
B ready now? Okay.
Yes.
So here is your question. Others can get ready with the chat box. Regarding normal saline, what is the sodium content and what is the osmolality? There are 2 parts. Please wait for 10 seconds. Others will quickly type the answer and send. What is the sodium content of normal saline? What is the osmolality? Time up. Please don't discuss loudly. Others will write from your answers. Okay. Madam, please see if you have got the answers.
Yes.
Okay. Team D can answer now.
Sodium content is 245 milliequivalents per liter.
Osmolality?
Osmolality is 0.9.
Oh, I'm sorry. I can't give points for that. Ma'am, can you just read out the answers? Did you get correct answers? So sodium chloride or normal 0.9% sodium chloride?
0.9% by team F and team C 0.9% and 289.
Okay, no. Actually, sodium content is 154 milliequivalents per liter. And so osmolality comes to about double of the sodium content, 308. So I don't think we can give points to any of these, madam?
Yes.
Okay, so this question will not give points to any of the teams. None of them have got it right. So if you have an answer, quickly type it and send. If you don't have an answer, send N also. Okay, fine. So we will move on to the next question. Team E, are you ready?
Yes, ma'am.
Okay, good. So other teams, get ready with your chat box. This is your question. The maximum accepted sound level in an NICU as per AAP recommendation is. Time starts now. 10 seconds, please wait. Let others send the answer. Time up. Madam, please see if you got the answers.
Yes.
All the answers. Okay, team E can answer now.
50 decibel.
What is that?
70 decibel. 50 decibel and 70
No,
decibel.
I asked only one answer, right? Maximum accepted sound
50
level.
decibel.
Okay.
50.
Ma'am, can you please
70
go
decibel.
through? Okay.
70.
70. You want 70 to fix it on 70? That's enough.
Yes,
So
ma'am.
I can't ask for any more answers. Okay, ma'am, can you please go through the answers and see? So
A,
actually,
A 75 decibel, B 75 decibel, C 25 decibel, D 75 decibel, and team F less than 50 decibel.
Okay. So since the recommendation have correctly mentioned the cutoff as 45 decibels, I don't think we can give. Madam. So that as per recommendation we had asked. So 45 decibels is actually the recommendation, and none of you have mentioned 45. Team E was initially closer, then they moved away to 70. So even if that is a recommendation, this table gives you roughly around what is the sound levels of different events which is happening in our NICU. So I just put this table to make us all aware about how much of hearing stress the babies will be having in an NICU. Okay, so that question also will not give points to any of the teams. So next question is to team F. Team F, are you ready?
Ready, madam.
Okay, good. Others, please be ready with your answer in chat box. Here is a question for team F. It's regarding bacterial culture. Okay, bacterial culture is for rapid detection of microorganisms. What is the basic principle of bacterial culture? The time starts now. Just write what is the basic principle, the key thing only. All of you have heard of bacterial culture. What is the basic principle of bacterial culture? Others can quickly type and send. Okay, time up. Madam, can you please see if you got any answer?
Okay, B, A, C, and D has sent their response.
Okay, so team F can answer now. Can you make a guess? No negative points, you can make a guess.
For finding blood culture,
Okay. Guess basic principle. Okay, fine. Ma'am, can you please go through the answers?
Answers, none of them have answered correctly.
Oh, okay. So it is basically, it detects the carbon dioxide released by the microorganisms using a fluorescent method. And that's why it's very rapid. We get the results rapidly. So it's basically detection of the carbon dioxide, which is produced as a part of the metabolism of microorganisms. Okay, so none of them have got it right. So the team question 6 to the F team F also doesn't give points to any of the teams. So with that, we have come to the end of first round. Can we have a question for the audience to just make sure that audience are along with us? The question is, we have all heard of N95 mask. What does N stand for? What does 95 stand for? Audience, if possible, you can just type the chat in the chat box and send. Type to everyone in this chat box, or you can unmute and say if you are there. One of you. Answer undo, madam. What does N95 stand for? Audience illengi team members ne venengi aayakam.
Correct. Binduja has answered 95% protection.
Okay, very good. So one part is correct. What about N? Any of the teams no? Can unmute and tell that.
Non-oil.
Okay, it's come, ma'am. Very good. So that is exactly correct. That is called
by team E.
Oh, very good, very good. So good going, team E. So it is, but no points for that. It is. It's when if it can be used if no oil-based particulates are present, and as rightly mentioned, it gives 95% efficiency. Fine. So we'll move on to the scoreboard now. Nimita, can you just share the score? I'll stop sharing now. I hope Nimita is ready.
Yes, ma'am.
Okay. So at the end of round 1, we'll just have a look at the score.
So at the end of round 1, we have team A, B, and C with each with 10 points, and team D, E, and F are yet to open their accounts.
Thank you, Nimda. So we have just started with the first round. So we have enough and more rounds left. Can you stop sharing, Nimda? Then I'll share. Okay, thank you. We'll move on to the next round now. We have the round on essential newborn care. This also starts from A to F. Team A, are you ready? Can I hear from you,
Yes,
Team
ma'am.
A?
Yes, ma'am.
Okay, good. So this is your question. Others be ready with the chat box. A term baby at 48 hours of life seen during the morning rounds is found to have erythematous macules with a central pustule, which is scattered over the trunk, face, and proximal extremities. Okay. The staining and microscopy examination of smear of the vesiculopustular contents, whatever contents is there, that was stained, which showed predominance of eosinophils. Okay, the question is, what is the diagnosis and what is the management? You can wait for 10 seconds. Others can quickly type what is the diagnosis, just the short diagnosis, and what is the management. That's all. Please don't answer now, and don't discuss loudly also, because your answers are heard here. Okay, time up, madam. Can you please see if you got the answers?
I got answers from team B, team F, and team C.
Okay, so team A can answer now.
Diagnosis is erythema toxicum. No adequate management is needed. It will succeed, revive normally.
Wonderful.
Excellent.
Very good. So 10 points to team A. Nimita, please note 10 points to team A. Good going. So as rightly mentioned, it's erythema toxicum and no management is needed. It will settle by itself. Very good. And so the team, the next question to team B. Team B, are you ready? Team B,
SAT
audio കേൾക്കുന്നില്ല. ഇല്ലേ? Okay. Please be loud, okay? And this is your question.
Wait for 10 seconds.
Yeah, wait for 10 seconds to answer. Others can type in the chat box. This is your question. A term male newborn was admitted to NICU on day 7 of life with bleeding from umbilical cord stump and bleeding from venipuncture sites. On examination, he was active. Systems was unremarkable. Lab showed a PT, INR, and APTT prolonged or increased, and platelets were normal. Okay, what is the diagnosis? That's the first question. And which step in the essential newborn care will prevent this? Time starts now. Please wait for 10 seconds. Others will quickly type what is the diagnosis and what step in the essential newborn care is needed to prevent this. That's all. Okay, madam, did you get the answers?
Wait. I got answers. Yeah, I got answers from team A, C, E, and D.
Okay, fine. Team B can answer now. Team B, are you there?
Because of the deficiency of vitamin K, which is innate.
Okay.
And give vitamin K injection during the birth.
Okay, very good. So the answer is correct. How much can you mention the dose also? Then it will be complete.
Less than 1 kg, we can give 0.5 mg IM, and then if the baby is more than 1 kg, we can give 1 mg.
Wonderful. So 10 points to team B. Okay.
Some of the team members have mentioned it is the hemorrhagic disease of newborn. It is correct, but hemorrhagic disease of newborn is an old terminology. Current terminology is vitamin K deficiency of newborn or vitamin K deficiency of neonates. Okay.
And they fall into the classical vitamin K deficiency bleeding. Okay. And as they've rightly mentioned, vitamin K prophylaxis at birth. Fine. So we'll move on to the next question to team C. Team C, are you ready?
Yes, ma'am.
Okay. So here is your question. Identify the breastfeeding position. And the second part of the question is, what is the role of bifidus factor in breast milk? Time starts now. Please wait for 10 seconds. Others will quickly type what is the breastfeeding position and what is the role of bifidus factor. Just the keyword. Time up. Madam, answer കിട്ടിയോ?
Postgradual position.
Wait. Madam,
Okay, I got the answers.
Fine. So team C can answer now. Yeah.
Postgradual position. Factor immunity.
You should be more specific. The first part we took. We can give 5 more seconds for you. Second part in കുറച്ചും കൂടി adjectives വെച്ചിട്ടാണ് ഒന്നുകൂടി qualify ചെയ്യണം ആൻസറിനെ. ഇല്ല, അത്രേ ഉള്ളൂ. Okay, so I'll give 5 points to team C. Nimita, please note the first one is actually what they've told is correct. It's a cross cradle position. So 5 points to team C. The second part, madam, can we have the answers?
Answers only second part is correct only. Need to show the answers.
Okay, so actually it promotes the growth of lactobacillus.
Okay, so the team B has answered as probiotic mechanism.
Okay, I think we can give it to them.
Give it to them,
So
yes.
2.5 points to team D, madam. D.
Yes.
Okay.
Team B.
B. Okay, fine. Sorry. So Nimita, please note.
Boy or B or D?
B. Boy.
B. Boy. Okay. Team B gets 2.5 points, and team C has already got 5 points for the first part. So since the action was so specific, it is an oligosaccharide which promotes the growth of lactobacillus. That's why we wanted the answer of a probiotic mechanism. And cross cradle, you have got it right. Correct. Very good. So we'll move on to the next question. Are you ready?
Yes.
Okay, team D. Okay, this is your question. Others can quickly type in the chat box and send. It's regarding the new Ballard scoring, which is used to assess the gestational age in newborn. Please don't discuss loudly. The score ranges from dash to dash, and which corresponds to which all gestations. So which is the lowest score, which is the highest score, and which all gestations. Time starts now. Please wait for 10 seconds. Madam, did you get the answers?
I got answers from team A, B, and E. Others, please.
Okay, I think then team D can answer now.
Yes, madam.
Okay. So new Ballard scoring, as you know, it is an scoring to know the gestational age of the infant. It starts from -10 to 50, which corresponds to 20 weeks corresponds to -10, while 44 weeks corresponds to 50. Ma'am, has any of them got the whole thing correct?
Team A answered that week, that is 20 weeks to 44 weeks.
Okay. Then
Team A.
Anybody else?
No.
Okay, so team A gets 2.5 points. Nimita, please note team A gets 2.5 points. Okay. I hope it's clear to all of the teams. So we'll move on to team E. Team E, are you ready? Team E, kekunilla.
Yes, ma'am.
Here is your question. A newborn baby was admitted with classical waiter's dip posture. Okay. Later, the baby developed irregular and labored breathing with cyanosis. What could be the most probable cause? Time starts now. Please wait for 10 seconds. Others will quickly type and send it to Dr. Febi. What is the most probable cause?
What is the most probable cause for irregular and labored respiration with cyanosis?
Exactly. What is the cause for irregular and labored respiration with cyanosis? Time up. Madam, answer kittiyo?
Yes. Yes, got answer.
Okay, team E can answer now. Team E? Team E, are you there?
Herbs palsy, ma'am.
Question is, what is the most probable cause for the breathing problem? Irregular and labored respiration ഉണ്ടല്ലോ. അതിന്റെ cause എന്താണ്? അറിയാമോ? പറഞ്ഞോ, പാസ് ആണെങ്കിൽ പാസ് പറഞ്ഞു. Then we'll move to the next one quickly. ഇല്ല, ആൻസർ ഇല്ലല്ലോ?
ഇല്ല, ma'am.
Okay. ശരി, കുഴപ്പമില്ല. അപ്പൊ ടീം മാഡം ഒന്ന് നോക്കാമോ ആൻസേഴ്സ് ഉണ്ടോന്ന്?
All teams are answered as Erb's palsy, and
Oh.
team D also brachial plexus injury, but it's not specific.
Okay,
Sure
okay.
answer.
Okay. So as madam correctly pointed out, we had asked for the cause for the respiratory distress. So that is nothing but phrenic nerve palsy. So it's actually diaphragmatic palsy which is causing respiratory distress. All babies with Erbs need not go for respiratory distress. When they develop respiratory distress and labored breathing, that could be because of the phrenic nerve palsy, because it's the same nerve root involvement, upper brachial plexus. So I can't give points to any of them. We'll move on to the next question. Team F, are you ready?
Yes, ma'am.
Okay, so this is your question. Others, get ready with the chat box. The newborn screening program in Kerala, which was launched in 2012, screens for 4 congenital disorders. Okay, name the 4 congenital disorders. Time starts now. Others, quickly type, just short form ആയാലും മതി, ഏതൊക്കെയാണ് 4 disorders എന്നുള്ളത് type ചെയ്ത് അയക്കാം. Which are the 4 congenital disorders for newborn screening program? Quick ആയിട്ട് type ചെയ്ത് അയച്ചാൽ മതി. Okay, time up, madam. Answers കിട്ടിയായിരുന്നോ?
Okay, got.
Team F can answer now.
Congenital adrenal hyperplasia.
Okay.
Infant galactosemia.
Okay. കഴിഞ്ഞോ? വേഗം പറ. Okay, no more answers? Team F. So I think we can't give more time. We'll stop with that. So they've answered 2 out of 4 correctly. So Team F ne കാണാനില്ലല്ലോ. Team F, are you there?
Madam.
Okay. So you've got 2 out of 4 correct. So I'll give 5 points for that. 5 points for Team F. Nimita, please note. And can any of the other teams, since the question is not open to other teams, we can't have a look at the chat box. I know you have got it correct. Can any of the others unmute and tell me the next 2 disorders screened in previous? Okay, Team B is trying to answer, but it's not audible.
They have during chat.
They have
chat
sent
box
it. Okay.
correct.
So we can't give points for that. But so the other 2 disorders are, the commonest one is congenital hypothyroidism. This you should have mentioned, and J6PD deficiency. Okay. So these are the 4 disorders in our newborn screening program of Kerala. Now, so that finishes our round 3. We will continue with round 2. We'll continue with round 3 as well, and then we'll go and look at the scoreboard. Okay. So round 3 is regarding the intensive newborn care. This also starts from Team A to Team F. Team A, ready or now?
Yes, ma'am.
Okay, so this is your question. Studies show that therapeutic hypothermia is beneficial in neonates with moderate to severe hypoxic ischemic encephalopathy. Okay, it should be started within dash hours of delivery. The first part of the question. The second part is, what is the targeted temperature in therapeutic hypothermia? Time starts now. Others can type within what hours of delivery it should be started, and what is the targeted temperature.
2 questions.
2 questions are there. You can type both and send. Type quickly both the questions and send. Okay, time up. Madam, did you get the answers?
Yes, I got that.
Okay, Team A can answer now.
I think it's within 2 hours of delivery, the target temperature should be 33.5 degrees Celsius.
Okay, the target temperature, I think we can give it to them. So it's 33-34 degrees Celsius. And 2 hours, madam, do we have better answers for that?
Yes, definitely. team B, team F, team D, and team C answered correctly.
Okay.
It's
So,
6 hours. It's 6 hours.
fine. So it's 6 hours. And Nimita, please note the targeted temperature is 33 to 34 degrees Celsius, which is correctly told by team A here. So 5 points to team A, 5 points to team A, and 2.5 points for the first part to team B, C, D, and F. I hope it's clear.
Yes, correct.
Okay, thank you. So we'll move on.
C, D, and F, right, ma'am?
B, C, D, and F.
Okay, ma'am.
Not to E.
E.
Yes, yes.
So they get 2.5 points. So that is the first question. We'll move on to the second question. Team B, are you ready? Okay, team B, the volume. I mean, audio. Okay, ready? So the others can type in the chat box. This is a question for team B. A term male baby was born by emergency LSCS, had meconium stain liquor, did not cry after birth, was admitted to NICU with severe respiratory distress. A few hours later, distress mildly improved on ventilator, but saturation did not improve even on 100% O2. A significant saturation difference was there between the right upper limb and lower limb, which was noted. So the question is, what is the possible diagnosis? That's the first part. And how will you confirm? The second part. Time starts now. Team B, please don't answer now. Others will quickly type and send it to Dr. Febi. So what is the possible diagnosis and how will you confirm? Okay, time up. Madam, can you just see if you got the
Yes,
answers?
I got the answers.
Okay, team
Some
D
other
can
time.
answer now. Please answer loudly. Unmute and yeah.
CPHM, it can be the possible diagnosis, and we can test by. Madam, is it audible?
Yeah,
Yes,
yeah.
yes, continue.
We got the first part. Yeah, I can test it by. I mean, confirm it by.
X-ray and hyperoxia test.
Okay, is that your final answer?
Yes.
Okay, so we will hold it there. The first part they have correctly told it is PPHN. That is correct. So 5 points to team B. Madam, do we have the confirmation?
Team F and team C has answered as PPHN and echocardiogram.
Okay, so I think that makes a better answer. So the confirmation is always by an echocardiogram. The others will give you a clue towards PPHN. That's all. So team B will get 5 points, and team madam?
Team C and team F.
Okay, team C and team F will get 2.5 points. Nimita, please note, team B will get 5 points and team C and team F will get 2.5 points. Okay, so as rightly mentioned, it is actually a persistent pulmonary hypertension secondary to meconium aspiration syndrome, but the confirmation is usually by an echocardiogram, which will show a high pulmonary artery pressure. Okay, so that is regarding the second question. We'll move on to the third question. Team C, are you ready?
Yes, ma'am. Ready.
This is your question. A high UAC, umbilical artery catheter, position is associated with significantly lesser risk of clinical vascular compromise and thrombus formation. What is the level of a high UAC? Time starts now. Please don't answer. Others can quickly answer through the chat box. Time up. Madam, can you please see if you got the answers?
Okay, I got the answers.
Okay, team C can answer now.
T9 to T10 level.
I'm sorry, I can't give points for that. Madam, can you please see if we got the
better answer is team F, that is T6 to T9.
Very good. So team F has got it right. It is T6 to T9. Nimita, please note 5 points to team F. Okay, so it is basically where the position which avoids the original of other bigger vessels from aorta. So the appropriate placement of tip should be in between T6 to T9 if it is a high UAC. Okay, so team F gets 5 points for that. We'll move on to the next question to team D. Team D, are you ready?
Yes, ma'am.
Okay, so this is your question. It's regarding HFOV in newborn, high frequency oscillatory ventilation in newborn. What is the ideal chest wiggle on HFOV? Time starts now. Just mention what you have to observe to know that the chest wiggle is ideal. Just write a brief thing and send it to Dr. Febi. What is called ideal chest wiggle on HFOV? Madam, did you get the answers?
Okay.
Undo, madam. Kittiyo.
Yes.
Okay, then team D can answer now.
No, ma'am, we don't know.
Okay, that's fine. Ma'am, can you go through the answers if any of them have at least mentioned
No.
similar things? Ila.
Team B has mentioned vibration, but it's not specific.
Okay, can we give an opportunity for team B to maybe they didn't finish it writing. Team B, please unmute quickly and tell what you want to what you wanted to answer. Team B, are you there?
Yes, yes, ma'am.
Okay.
Frequent chest movements we can observe in the babies when HFOV reaches. Madam, audible ആണോ?
അല്ല audible അല്ല. കുറച്ചുകൂടി clear ആയി പറയണം.
Madam, frequent vibrations we can see on the chest wall of the baby.
Oh, okay. Please specify on the vibrations. Please specify. We can't hear you, Team B. I don't know what you're going to do for the rapid fire round. Paryu?
All frequency oscillations. Madam, high frequency oscillations on baby's chest.
No, it's not specific. They've mentioned vibrations on chest wall. Atre paranjitullu. So should we give it, madam? I don't think we should.
No, I don't think.
Yeah. So you should be very specific when you refer to the chest wiggle. The answer should be very specific. Team B can please mute. I'm hearing echo. Okay, thank you. So it is actually the vibration from the level of clavicles, both clavicles till mid thigh. That is called an ideal chest wiggle. Okay, so that is and the chest wiggle increases with the increase in amplitude and should be reassessed after every position change. If you find that there is unilateral chest wiggle, that means there is either an ET tube displacement or a pneumothorax on the other side. If there is bilateral decrease in chest wiggle, that means the vibration itself is coming down bilaterally, means there is some ET obstruction or a decreased pulmonary compliance. Okay, so that is regarding chest wiggle in HFOV. So we'll move on to the next question to Team E. Team E, are you there?
Yes, ma'am.
Okay, so this is your question. Others get ready. Surfactant therapy is the medical administration of exogenous surfactant in a preterm with RDS. Okay, what is early rescue surfactant therapy? Your time starts now. Please wait for 10 seconds. Others can type it in chat box and send. We'll give them 10 seconds. Time up. Madam, please see if you got the answers.
Okay, stop.
Team E can answer now. Team E. What is early rescue surfactant therapy? Answer undo. Clear I parayana answer undu. Parnolu. Clear I parayana.
The therapy we are giving less than 30 weeks of preterm babies.
That is specific to early rescue therapy.
30 weeks no early. There is something else which is early. Okay, so I think we can't take the answer and take that answer. Madam, can you please see the chat box if somebody has got it correct?
Our participants answers are all A, B, D, C, and their answers are wrong. Only audience, one Vijay Lakshmi has answered. But make sure that the audience please don't send the answers through chat box. Okay.
Exactly.
It's everyone.
Please don't send the answers to chat box because it will be visible to all the teams. So please don't do that. We know we have a very good, very knowledgeable audience we have, but unless you are asked to, please don't send the answers in the chat box. If at all, if they want, they can send it directly to you, madam. You can,
Yes, they can send
directly to
me.
Dr. Fabi, but not to everyone, so that everyone can see that answer. Okay. So no points for that. As madam mentioned, it should be the surfactant administration before 2 hours, within 2 hours of birth. Okay, so that is early rescue surfactant. That is when the minimal signs of respiratory distress starts within 2 hours of, as early as 2 hours. If we give them surfactant, it's called early rescue surfactant. Okay, so it's not related to the weeks of gestation, as you mentioned. So now we'll move on to the next question to team F. Are you ready?
Yes, madam.
Okay, good. So here is your question. Others be ready with the chat box. An infant is born to a primary mother by vacuum extraction. Okay. Over the next few hours, a swelling appeared over the scalp, crossing the sutures, with mild discoloration, and the head circumference was increasing. Baby had progressive pallor and became hypotonic and then started having seizures. Okay. The question is, what is the probable diagnosis here and what is the complication expected? Please wait. Time starts now. Others can type the answer quickly. What is the probable diagnosis? What is the complication? Just one word is enough. Type both the words and quickly send it to Dr. Fabi. Okay. Madam, did you get the answers for the 6th question?
Okay, I got the answer.
Okay. Team F can answer now. Team F, are you there?
Ma'am.
Parayu, answer parnolu.
Ma'am, a subgaleal hematoma, complication hyperbilirubinemia.
Okay, so 5 points I can give it to you. Subgaleal bleed, it's like a subgaleal bleed. But is that the dreaded complication of subgaleal bleed we are worried about? Are we worried about hyperbilirubinemia there? Subgaleal bleed പറയുമ്പോൾ തന്നെ കുറച്ചും കൂടി ഫാസ്റ്റ് ആയി പറയണം എന്നുള്ളതാണ് അല്ലേ മാഡം? It's such a scary thing. So we can tell the answer as easy as that. It's not just it's a subgaleal bleed. Okay, so what could be the complication? Because it's bleeding onto the loose tissue, there'll be no. Now I can't give any more chance for you. So 5 points to team F we can give. Madam, do we have correct answers for the second part?
Yes, team A answered correctly. It is shock.
Okay. And only team A, no?
Team E, anemia, but it's not
that we can't give. Yeah. Okay. So team F will get 5 points. Nimida, please note. And team A will get 2.5 points. And as rightly mentioned, the huge bleed will cause nothing but hypovolemic shock. That means we have to act fast. So it is not hyperbilirubinemia, the problem of subgaleal bleed. It's more than that. It's hypovolemic shock. Okay. So that finishes the 3rd round, and we have an audience question here. In the meantime, Nimita will get ready with the scores. So this is a question for audience. Identify this personality. Audience, can please type the answers and send. I think all the team members know the answer, but we'll give a chance for the audience. Madam, answer എന്തെങ്കിലും കിട്ടിയോ? Even you can type it to everyone. Chat box le everyone and type ചെയ്യാം അല്ലെങ്കിൽ directly to Dr. Fabi also, no issues.
No.
ഇല്ല, ആരും വന്നില്ല. Teams, can anybody answer? Can unmute and tell the answer. Yeah, team B. Team B answer പറഞ്ഞാൽ പക്ഷെ കേക്കില്ല.
Yes.
പറഞ്ഞോളൂ, team B. Armida Fernandez. Okay. Team B, I'm very sorry to say that your sound is not at all audible. So please find an alternative. At least by the time we reach rapid fire, get another phone and log in through that. Please find an alternative for that. Otherwise, you will lose points in rapid fire. Okay. So as rightly mentioned by Team B, it is none other than Professor Armida Fernandez, who was the person behind the first human milk bank in Asia. So now we have milk banks in our small state as well. You have all heard about that. So she was the pioneer in setting up a milk bank in Mumbai. Okay. So we'll move on to the scores. Can Nimita share the screen and tell us about the score?
So at the end of round 3, we have Team A with 30 points, Team B 30 points, Team C 20 points, Team D 2.5 points, Team E is yet to open its account, Team F with 20 points.
So good going, all the teams. Nimita, sharing stop. Okay. I hope there is no confusion among the team members regarding the score also. If at all something is there, please tell us that time. I mean, immediately. Okay, so we will move on to the next part of the quiz, round 4. Are you ready? So this will start from Team F. Team F, are you there?
Yes, ma'am. Yes, ma'am.
So here is your question. Are you ready? Team F.
Ready, ma'am.
The chat box. This round is on recent advances. Okay. So here is your question. You might get a little tougher side, questions on tougher side, but don't worry. This is how we learn. This is all basically a learning session for all of us. So identify this equipment and what is the conventional method of screening done for this disease? Time starts now. Others quickly type and send. What is this equipment? That is the first question. And it is used for something. And what is that we are doing conventionally for that disease, since we don't have this equipment now?
Identify the equipment. Name the equipment.
Name the equipment. Time up. Madam, did you get any of the answers?
Okay. I got answers from Team B, D, C, and A.
Okay. Team F can answer now. Team F, please unmute and answer. Team F, please unmute. Parnolo.
Read echo.
Illa. Sherry, it's not the one. Madam, can you please read out the answers? Have they, any of them got it right?
Yes. Team B answered it as ROP and ophthalmoscopy.
Okay. So any other answers? Can we give the Team B a chance to tell what it is?
Name the equipment.
The Team B can quickly unmute and name the equipment.
No idea, ma'am. No idea what the equipment.
Oh,
I don't
You have in your unit. That equipment you have in your unit.
രാധികമാഡത്തിനോട് പറയാം.
ഇത്രയും വലിപ്പമില്ലാന്ന് മാത്രമേ കമ്പ്യൂട്ടർ ഷേപ്പ് ഫോൾഡ് ചെയ്യാൻ പറ്റുന്ന ചെറിയൊരു എക്യുപ്മെന്റ്.
Anyway, we won't give points for that after the clue, but you can tell for the sake of answering it. You can tell.
Ophthalmosonography.
അല്ല. Ophthalmic ultrasound അല്ല.
ROP സ്ക്രീൻ ചെയ്യാൻ വേണ്ടി നിങ്ങൾ എല്ലാവരും ബാംഗ്ലൂർ പോയി ട്രെയിൻ ചെയ്തത്.
ഞങ്ങൾ പോയിട്ടില്ല.
ആൻസർ പറയുമ്പോൾ എല്ലാവരും അയ്യോ എന്ന് പറയാൻ പോകുന്നുണ്ട് വേണം കണ്ടോളൂ. So it is nothing but RECTCAM. And and the conventional method, as you mentioned, is indirect ophthalmoscopy. So 2.5 points to Team B. Nimita, please note 2.5 points to Team B. Ma'am, any of the other teams have got the second part correct?
No. No other team has answered.
Okay.
And it's Team B.
Team B, box.
B
box. Okay. So the next question is to Team E. Team E, ready or no?
Yes, ma'am.
Okay, this is your question. Currently, all NICUs prefer to use pulse oximeter with Massimo technology. Okay, what is the basic technology? Massimo nu chale endana. What is the technology called? Time starts now. Please wait. Others will type the answer and send. What is Massimo technology? Okay, time up. Madam, answer kittiyatho?
Yes, I got the answers.
Okay, so Team E can answer now. Team E, please unmute and answer quickly. Okay, no worries. If you don't know the answer, you can just tell pass. Don't worry. Okay. So, ma'am, can you please go through the
Team
answers?
F answers correct. That is signal extraction technology or SET technology.
Okay, very good. So Team F gets 5 points. Nimita, please note. Team F gets 5 points. Okay, so as rightly mentioned by them, it is signal extraction technology. Basically, it measures the saturation even through motion and in low perfusion states. That is
To
how it
avoid the motion and low perfusion artifacts. Okay.
artifacts.
To detect a pulse oximeter correctly while child is moving or baby is moving the limb, this technique is used. That is SET technology.
Okay, so that is regarding the question to team E. We now will move on to team D. Team D, are you ready?
Yes, ma'am.
Okay, this is your question. We have all heard of Apgar score. Ale. So what does combined Apgar score indicate? Just write what is, other teams write what is combined Apgar score indicate. Time starts now. Please don't tell the answer, you have 10 seconds. Combined Apgar score, what does it indicate? You need not tell what all things in combined Apgar score. What does it indicate? Madam, please see if you got the answers.
Yes, team B and F answered.
Team D, it's the direct question.
Team B and F.
Okay, okay. Team D can answer now. Team B, Team D, please answer.
We don't know.
Okay, no worries. So, ma'am, team, can you read out the answers of team B and F?
Team F answers wrong. That is baby is allowed. That is wrong. And team B answered is mask and oxygen.
Okay, so
yeah.
Team B again can unmute and tell what you mean.
Madam, CPAP.
Yes.
CPAP.
Okay.
Measures, interventions used during resuscitation.
Fine. So I think we'll give 5 points to team B. Team B gets 5 points. Nimida, please note, team B gets 5 points. So as rightly mentioned, those are the interventions or maybe the interventions of our advanced resuscitation received during birth are also mentioned as combined, and combined is a mnemonic of these three. These all. Fine. So with that we'll move on to the next question to team C. Are you ready?
Yes, ma'am.
Okay, this is your question. Identify the part of bubble CPAP shown in this picture. The part. Okay. And tell us what is the use. Time starts now. Others can quickly type what is the part of bubble CPAP and what is its use. What is it used for? Team C has to wait for 10 seconds. Madam, did you get the answers?
Yes, I got that.
Okay. So team C can tell the answer now.
Heater wire attached ചെയ്യുന്നു.
അതല്ല അതായത് ഇൻലെറ്റ് ട്യൂബിങ്സിൽ ഗ്രീൻ വയറിന്റെ താഴെ
ആൻസർ പറയിപ്പിക്കാൻ പാടില്ല. Okay. ഉണ്ടോ ആൻസർ ഉണ്ടോ? One more chance. Yeah.
Oxygen delivery.
No more. Can't give points for that. Madam, will you see the answers?
Yes. Team B, Team E, and Team F. But Team F answer is not clear because it's written as valve. It is a pressure releasing valve or safety valve. It's called as pressure manifold.
So team F we can't give points. Team B and team E has got it right, madam.
Team B and E.
Okay, good. So as rightly mentioned, it's called pressure manifold and it is a safety valve to release the excessive pressure in the circuit. So team B and team E. Nimida, please note. Team did they mention the function also, ma'am? Both teams?
B mentioned function.
Okay, so team B will get 5 points and team E will get 2.5 points. Nimida, please note. Team B will get 5 points and team E will get 2.5 points for the question. Okay, clear. So we will move on to the next question to team B. This is your question. Identify this equipment and what is its mechanism. There are 2 parts again. Time starts now. What is the equipment and what is the mechanism of action? Not the use, we may ask. Mechanism. Others can quickly type the answer. Team B has to wait for 10 seconds. Okay, madam, please see if you got the answers. What is the equipment and what is the mechanism?
Okay, got answers.
Okay, team B can answer now. Team B.
Madam, it is called as embrace. It is for transporting the newborn using wax to means complete for the thermoregulation of the baby. Using the wax, we can preheat it and use for transportation of the baby in order to prevent the baby from getting hypothermia.
Okay, I think wax, since they have told the wax, term wax, I think we should give it 11.
Yes. That's exact terminology for it.
What is the exact terminology? Why? What is the wax has to do with that?
Means
Why wax?
Regulation.
Other samajho, thermoregulation is the use. We asked for a mechanism.
Ma'am, I knew it.
So we'll give 2.5 points for the second part and
Okay,
5 points for the first part. Okay.
Okay.
I think that will be a better.
Fine, ma'am. Fine.
Okay, fine. So, Nimita, please note, Team B gets 7.5 points for this question. The first part, they've got it correct. It's an exothermous mattress called Embrace. And the mechanism is actually called a phase-changing material. The wax is a phase-changing material, okay, which can keep the baby warm for 4 to 6 hours. And thankfully, we hear a better audio from Team B this time. Very good. So please be like that. Don't touch that. So that is regarding the question to Team B. We'll move on to Team A. Are you ready? Team A, are you there?
Yes, ma'am.
Oh, very good. So this is your question. Identify the monitoring device on the scalp of this baby. Just tell what is the monitoring device. Time starts now. 10 seconds. Please wait. Others can quickly type and send. What is the monitoring device? Time up. Madam, did you get the answers?
Okay, I got that.
Okay, Team A can answer now.
Impedance technique for detecting apnea.
Oh, I'm sorry, that's not correct. Madam,
No other team has answered.
Okay, so I think this was a tougher one probably. So this is actually called near infrared spectroscopy, or a NIRS. It is actually for the measurement of cerebral oxygenation. The LED limit light that the light absorbance will be measured, and with the help of it, oxyhemoglobin and deoxyhemoglobin will be measured. So that tells us an indirect measure of a cerebral oxygenation in the baby. So it is called NIRS, N-I-R-S. Okay. So no points for that question to any of the team. We will move on to the next round. Fifth, the final passing round. Again starts from F. Team F ready now?
Yes, ma'am.
Very good. So this is the question for Team F. This is a visual round. Look at the picture closely and then answer the question. Others will type the answer in the chat box. Identify this method. You're seeing two pictures, both the same. What is it used for? The two parts of the question. Time starts now. What is this method called and what is it used for? Madam, answer കിട്ടിയാൽ. Madam, did you get the answers? Madam, mute.
Yes, got answers.
Okay, Team F can answer now. Team F, are you there?
Yes, madam. Drip method.
Okay, drip and drop method. And what is it used for?
Madam, if the baby is not sucking, then we are and mother have not adequate milk, then we are giving.
Sucking reflex is not adequate.
Okay. You want to add some more to the answer? Modify the answer. We can't take it fully. It's not. We don't use it for all the babies who are not sucking. Either babies either mothers I think I can't give more time for this. On the answer on down. You want to modify the answer?
Protein and energy malnutrition all the babies.
Okay. Again, I think they are aiming for 2.5 points for the second question, madam. Okay, since the exact term has not come up, we'll give 5 points for the first question and 2.5 for the second question. So 7.5 points to Team F. Nimita, please note 7.5 points to Team F for the question. And what exactly is it? As you rightly mentioned, the baby is not sucking, mother doesn't have milk, and that is called lactation failure. Lactation failure protein energy malnutrition undengilana we'll do this. It's also called supplementary suckling method or drip and drop method, as you've mentioned, because the milk flowing through the tube will stimulate the baby, because there is a constant flow and the baby will suck continuously, so that the mother will start relactating again. Okay, so that is regarding the first question. We'll move on to next question to team E. Team E, are you ready?
No other team has answered.
No, okay. Anyway, they've
one more
answered.
thing, this is baby healthy ആയിട്ടുള്ള ബേബി ആണെങ്കിൽ മാത്രമാണ്. ഓക്കെ, ഇന്നാഡിക്വേറ്റ് ബ്രസ്റ്റ് മിൽക്ക് ആണെങ്കിൽ അവിടുത്തെ മെയിൻ കമ്പോണന്റ്. ബേബി ആക്റ്റീവ് സക്കിംഗ് ആയതുകൊണ്ടാണ് നമ്മൾ സക്കിംഗ് ടെക്നിക്ക് യൂസ് ചെയ്യുന്നത്. സോ ബേബിക്ക് മിൽക്ക് കിട്ടാത്തത് കൊണ്ടാണ് ബേബിക്ക് പ്രോപ്പറായിട്ട് സക്ക് ചെയ്യാൻ പറ്റുന്നത്. അപ്പോൾ ഒരു സ്റ്റിമുലസ് കിട്ടിക്കഴിഞ്ഞാൽ ബേബി ആക്റ്റീവായിട്ട് സക്ക് ചെയ്യും. അതിനുവേണ്ടി നമ്മൾ എക്സ്ട്രാ മിൽക്ക് സപ്ലിമെന്റ് ചെയ്യുന്നു. ദാറ്റ് സ്റ്റിമുലേഷൻ, ദ സക്ലിംഗ് സ്റ്റിമുലേഷൻ വിൽ പ്രൊഡ്യൂസ് milk in the mother. So this technique is called as drip and drop method or supplementary suckling technique. Okay.
So we'll move on to the next question to team E. Team E, are you ready? Team E. Kekunilla. Team E, are you there?
Yes, ma'am.
Okay. So this is your question. Identify this. And the second question is, what is the minimum weight of babies for whom this can be used? Time starts now. Don't tell the answer. Don't tell the answer. Please mute. Others can type the answer and send. If you tell the answer loudly, others will also get points. Okay, time up. Madam, please see if you got the answers.
Okay, I got the answer.
Okay, team E can tell the answer now.
Laryngeal mask, ma'am.
Laryngeal mask? Okay. And the second part, what is the minimum weight of the babies which can be used? Illa. I presume you don't have an answer for that. Answer illa.
Yes, ma'am.
Okay. So we give 5 points to team E. Team E will get 5 points. Madam, do we have an answer for the second part?
Team A and Team C answers 2 kg and Team F as 1.5 kg.
Okay, so we'll give it for 2 kg.
Yes.
So team A and team C will get 2.5 points. So Nimita can note, team E will get 5 points and team A and team C will get
Team C will get 2.5 points and Team A will get 2.5 points.
Okay, team A and team C will get 2.5 points. Nimita, clear alle?
Yes, ma'am.
Okay, fine. Thank you. So we will move on. So as rightly mentioned, it's LMA with the minimum weight being 2 kgs. We'll move on to the next question to team D. Team D, are you ready?
Yes, ma'am.
Okay, this is your question. What is the diagnosis here? And what is the management? Time starts now. What is the diagnosis and what is the management? Time up. Madam, did you get the answers?
Yes, I got that.
Okay, team D can answer now. Exomphalosalla. So since the first thing we got it wrong, we need not go to the second part of the question to them. So ma'am, can you please go through the answers and see?
No, most of the teams have answered as omphalocele.
Right. Other umbilicus, abdomen distender ആകാനാണ് തോന്നിയതായിരിക്കും അല്ലേ? So did you find anything in the near the umbilicus? ഇനി എന്താന്ന് പറയണോ? ആരെങ്കിലും ഒന്ന് വേഗം അൺമ്യൂട്ട് ചെയ്ത് പറയുന്നവര്. എന്താണ് അംബിലിക്കസിലുള്ള? എന്താ പറഞ്ഞു? ഗ്രാനുലോമ അല്ല. It's not granuloma. It is very bright red in color. It's actually an umbilical polyp. Umbilical polyp, which is actually the remnants will show some interstitial mucosa also. And bright red in color, and the treatment is excision. So it's neither granuloma nor an omphalocele. So no points to any of the teams. Okay. The next question. Team C, are you ready?
Yes, ma'am.
Okay, this is your question. Identify this. What disease is it used for? Time starts now. Identify this and what disease it.
Which disease it is used for?
Time up, madam.
Yes.
Did you get the answers, ma'am?
Yes.
Explain explained. It is used for congenital hip dysplasia.
Okay, what is it called?
Pavel explained. Pavlik period.
Okay, very good. So Team C has got it right, correct. So it's called Pavlik harness and it is used for developmental dysplasia of hip. Like previously called congenital dysplasia, now it's called development dysplasia of hip. And so 10 points to Team C. So Nimita, please note 10 points to Team C. Very good. So rightly mentioned, it's Pavlik harness for DDH. The next question is to Team B. Team B, are you ready?
Yes, ma'am, ready.
Oh, very good. So this is your question. What is the diagnosis? What precaution should be taken during resuscitation? Time starts now. Others will quickly type what is the diagnosis here and what is the precaution taken during resuscitation. Okay, madam, did you get the answers?
Wait. Yes, for that.
Okay, Team B can answer now.
Pneumothorax.
Okay, what precaution during resuscitation?
During resuscitation, we have to wisely use the oxygen as well as pressure.
Okay. Anyway, that is not the answer for the correct answer for the first question. Why do you think it's pneumothorax? Where is the air and is that just air seen there? There is air in the chest because something has gone from the abdominal cavity to the thoracic cavity.
Oh my God, CDH.
Ah, correct. So now they got it right, but we can't give points for that. So, madam, has anybody got it right?
Team A, Team C and E and F. Sorry, Team E, C, A answered as CDH, congenital diaphragmatic hernia. Team A mentioned that it should be intubated. Baby should be intubated.
Okay. So Team A will get 5 points. Nimita, please note. Team A will get 5 points. Team C and Team E, madam, will get 2.5 points. Team A will get 5 points. Team C and Team E will get 2.5 points. Okay. And I am sure that all the teams knew this. Maybe in a hurry of our quizന്റെ stressൽ അത് വിട്ടുപോയതായിരിക്കും. Especially Team B, they've realized it is CDH, nothing but congenital diaphragmatic hernia, and should not be bag and mask ventilation is contraindicated. Okay. So the next question is to Team A. Are you ready, Team A?
Yes, ma'am.
Okay, this is your question. A newborn was admitted with poor feeding. Okay, and ECG showed this. What is the diagnosis and what is the drug of choice? The time starts now. Please don't answer now. Others will tell the answer. Type the answer and send it. What is the diagnosis and what is the drug of choice? Time up, madam. Did you get the answers?
Yes.
Okay, Team A can answer now.
SBT.
Very good.
Adenosine.
Wonderful. Very good. So 10 points. Excellent. 10 points to Team A. Very good. So Nimita, please note 10 points to Team A. Anything more you want to add about adenosine? How will you give adenosine and all? Anyway, we'll take the answer. That's correct. So you give to a vein which is closer to heart, followed by a rapid push of normal saline. Okay. So that is regarding the visual round. With that, we have come to the end of all the passing rounds. We'll have an audience question fast. Then we'll go to the most exciting rapid fire round. Okay. So this is for the audience. Identify this symbol. All the teams, I know that. Audience, can somebody type the answer and send? Identify the symbol. Madam, answer or no?
Yes, Binduja has answered and Sharanya also.
Ma'am, answer getla, madam. And
Biohazard.
Oh, okay. It's not really biohazard. Okay. So teams?
Yes.
Any of the teams know the answer? Correct.
Radiation.
Radiation hazard. Okay, good. So with that, we've come to the end of all the passing rounds. I'll just stop sharing. I'll ask Nimita to share the screen and let us know about the scores. Nimida,
Unmute.
Nimida, please unmute and tell the score.
At the end of round 5, we have Team A with 47.5 points, Team B with 50 points, Team C with 35 points, Team D with 2.5 points, Team E with 10 points, and Team F with 32.5 points.
Thank you, Nimida. So we have a very close match going on. Anyway, we'll see. Rapid fire will be the decider mostly here. Thank you, Nimida. Can you please stop sharing? Then I'll share the screen. Okay, thank you. So if the teams are ready, we'll move on to the rapid fire round. As you know, this is not a passing round. So basically, you'll be asked 8 questions in 1 minute. And during that 1 minute, you can attempt whatever questions possible. If already attempted, you can't come back to that question and answer that again. Okay, no negative marks. There'll be 2.5 points for each correct answer. Okay, I hope it's clear. If you have any doubts, please ask right now, or we'll move on with the Team F. Team F, are you ready?
Yes, ma'am.
Okay, so here is your question. Time, we get 1 minute. Okay. So here is your question. Time starts now. Total number of events in 1 minute during neonatal resuscitation is? Don't know, tell pass. We'll move on to the next question. Drug of choice for dopamine extravasation?
Pass.
IMR, infant mortality rate in India according to May 2021?
Pass.
Theme for World Breastfeeding Week 2021 is?
Protect breastfeeding, share responsibility.
Correct. During PPV, positive pressure ventilation, the ventilation rate is dash per minute in newborn resuscitation.
Pass.
Expand OAE.
Auto acoustic emission.
Wonderful. Morose reflex will be present at birth. True or false?
True. True.
Correct. Neonatal seizures within 24 hours of birth are mostly due to biochemical abnormalities or inborn errors of metabolism. True or false?
True.
I'm sorry, that is wrong. So you got 3 points. Time is up. You got 3 questions out of it. Okay. So 7.5 points to Team F. Nimida, please note 7.5 points to Team F. And we'll quickly go through the answers. Total number of events of resuscitation 1 minute is 120. 90 cardiac compressions and 30 breaths. Drug of choice for dopamine extravasation, it's phentolamine. IMR is 28.3. Theme for breastfeeding, you've got breastfeeding week, you've got it correct. During positive pressure ventilation, the ventilation rate is, now you want to answer? 40 to 60 per minute. OAE, you have got it correct. Morose reflex will be present, and newborn seizures within 24 hours are less likely to be due to biochemical abnormalities. Mostly within 24 hours we get because of perinatal asphyxia, like hypoxic Carnot seizure. Biochemical abnormalities and inborn errors usually happens later. So that is false. So 7.5 points to Team F. Okay. Now let us move on to Team E. Team E, are you ready?
Yes, ma'am.
Okay. So make your voice clear. We need to hear clearly. Okay. So this is your question. Your time starts now. As per NRP recommendation, the minimum number of qualified people to be present to resuscitate a baby with risk factor is?
3.
Wrong. Web portal by National Health Mission for comprehensive newborn screening program is? If you don't know, we'll go to the next one.
No, ma'am.
Expand ANTT in infection control. We'll move on. If you don't tell no, please tell pass.
Ma'am, aseptic non-touch.
Okay, I'll give the points. Oxygen concentration for resuscitation for preterm newborns less than 35 weeks of gestation. Please don't mute in between. Keep it unmuted. Tell the answer now. You're unmute. What is it? You have the answer for that?
No, ma'am.
Okay, so
30%, ma'am. 30%.
sorry, time is up. We can't give the points for that.
Okay, ma'am.
That's okay. No worries. So, so you got one question correct. So 2.5 points to team E. Nimita, please note 2.5 points to team E. So these are the other questions. We'll discuss the answer now. As per NRP recommendation, minimum qualified people should be 2. And web portal is called Shalabam or Jatak Seva portal. And ANTT, you have rightly mentioned, aseptic non-touch technique. Oxygen concentration for preterm less than 35 is 21 to 30%. And MAP into FiO2 into 100 by PO2 is called oxygenation index. How long can breast milk be stored at room temperature? I think that answer you should have known. So that is the importance of going through the questions very fast. If you don't know the answer, you should pass and go to the next question. Maybe last the rendu question namakariya. So go fast to the next question. Okay. It's 4 to 6 hours. Newborn born to COVID positive mother should be tested for COVID at birth itself. No. Not really. Self-inflating bags used for neonatal resuscitation can be sterilized using 2% glute solution. That is true. So you get 2.5 points for the rapid fire. Nimita, please note 2.5 points. Thank you, Team E. Now you can mute. So Team D, I would request you to keep yourself unmuted. Daily mute the unmute. Okay. So Team D, are you ready?
Yes, ma'am.
Okay. So this is your question. Keep yourself unmuted. Your time starts now. During resuscitation, the baby's temperature should be maintained between dash and dash degrees Celsius.
36 to 36.5 degrees Celsius.
Okay, I'll give that. Expand TRIP score in neonatal transport.
Pass.
A past pulse oximetry screening is when there is a difference of dash % between preductal and postductal saturation.
Pass.
World Hand Washing Day.
Pass.
Resuscitation can be stopped if heart rate remains undetectable more than how many minutes?
5 minutes.
Wrong. Which hormone triggers the letdown reflex in lactation?
Oxytocin.
Correct. Newborn born to COVID positive mother should be admitted in COVID NICU even if not sick and monitored for symptoms. True or false?
True.
Wrong. Single umbilical artery. Okay. I'll finish this. Single umbilical artery may be associated with renal or gastrointestinal anomalies. True or false?
True.
Correct. So they got 7.5 points. Nimita, please note. Team D got 7.5 points out of that. The first question, I think they have mentioned 36.5. So I will give points for that. And TRIPS is transport risk index of physiological stability. Past pulse oximetry is less than 3% difference between the preductal and postductal saturation. World Hand Washing Day is October 15th. And resuscitation can be stopped if heart rate remains undetectable for more than 10 minutes. Oxytocin, you have got it correct. If you read this again, you will now change your answer. Newborn born to COVID positive mother should be admitted to COVID NICU even if not sick. Need not be, can be roomed in the same room as mother. So it is false. And single umbilical artery should be screened for renal and GI anomalies. Okay. So 7.5 points to Team D. Okay. We'll move on to Team C. Are you ready, Team C? Okay. So this is your question.
Team D, please unmute.
All other teams may please mute. Team C, please be ready. Okay. Team C, are you ready?
Yeah.
Okay. This is your question. Time starts now. Target preductal saturation at 1 minute after birth.
60 to 65.
Correct. World Prematurity Day.
Pass, madam.
Neonatal resuscitation is not indicated if gestational age is less than
24.
Wrong. Expand JSSK.
Pass.
Pass or no?
Pass, madam.
What are LASA drugs?
Look-alike, sound-alike drugs.
Correct. What is the depth of insertion of ET tube from upper lip in a 1 kg baby?
Pass.
Transient tachypnea in newborn is seen commonly in preterm babies. True or false?
False.
Eda?
False.
Correct. Breastfeeding is contraindicated in the first week of life for newborns born to COVID positive mother.
False.
False. Okay. Any question you want to attempt? Which you have not attempted? Eda, clear, please.
6, ma'am.
T1.
പറഞ്ഞോളൂ. Depth of insertion എത്രയാ?
T1 to T2.
അയ്യോ. Okay. Time up.
Okay.
Okay. I can't give points for that. So the first question, Team C got 4 questions correct. So 10 points to Team C. Nimida, please note, 10 points to Team C. So the question, we'll go through the questions once again. Target preductal saturation at 1 minute, 60 to 65%. World Prematurity Day is November 17th. Gestational age is actually 23 weeks, according to NRP guidelines. And JSSK, Janani Shishu Suraksha Karyakram. Okay. I think this you were familiar with. LASA drugs, you have got it correct. And depth of insertion is actually measurement in centimeters I asked for. It's 1 plus 6, so 7 centimeters. TTN is commonly seen in preterms false, and the breastfeeding contraindicated is also false. So you got 10 points at the end of rapid fire, Team C. Now we'll move on to Team B. Team B, are you ready?
Yes, ma'am, ready.
Okay. So be clear about your answer, loud and clear. Okay. So this is your question. Your time starts now. Dose of adrenaline given through endotracheal tube?
0.1 to 1.3.
Wrong. National Newborn Care Week?
September 21st.
Wrong. Target preductal saturation at 5 minutes after birth?
90 to 95.
Wrong. Extreme preterms are babies born before what gestational age?
24 to 28, I mean less than 28 weeks.
Correct. In newborn ventilation, the product of compliance and resistance is known as?
Glen complaints.
Wrong. Expand PICC, PIC.
Peripherally inserted central catheter.
Correct. Fenton's chart is used to plot postnatal growth in preterms. True or false?
False.
Wrong. Multisystem inflammatory syndrome, a complication of COVID, can present in newborns also. True or false?
True.
Correct. So they have attempted all the questions and they got 3 questions correct, and the time is okay, just finished. So 3 questions. So 7.5 points to Team D. Nimida, please note 7.5 points to Team D. I had asked for endotracheal route. So what is the dose? You have any?
1 mg. 1 mg.
Correct. Okay, it's 0.5 to 1 ml per kg. Okay. So National Newborn Care Week is not in September. It comes in November 3rd week, 15 to 21st. And target preductal saturation 5 minutes is not 90, it's 80 to 85. In extreme preterms, you have mentioned neonatal ventilation product of compliance and resistance is called time constant. PIC, you have the expansion of PIC you have mentioned. Fenton's chart is used for preterm postnatal growth monitoring. That was a true statement. And multi-system inflammatory syndrome is also being reported in newborns. So it's called MISN, newborn. So you got 7.5 points at the end of rapid fire. Okay, good show. Now, Team A, are you ready? Team A?
Yes, ma'am.
Okay, so this is your question. The time starts now. Others may please mute. I request all the other audience to please mute. Okay. Thank you. This is your question. In NRP, the chest compression should be initiated if heart rate is less than dash, despite adequate ventilation. What is it?
60.
Okay, correct. Expand PDHM.
Pass.
What is Lakshya program?
Labor room project.
You want to expand?
Bonding with the
It's okay. Okay, I'll give it to it. What is sucrose 24% solution used in newborns?
Analgesia, for analgesia purpose.
Very good. Weight cutoff for stopping KMC?
2 kg. 2.
Wrong.
2.
I can take only one answer. What is P in MR SOPA?
Mask adjustment, reposition, suction.
P. What is P in MR SOPA?
Pressure.
Correct. Fetal tachycardia, late deceleration, decreased variability indicate fetal distress. True or false?
True.
Correct. Antenatal steroids, okay, time up, decrease the incidence of IVH and NEC in preterm newborns. True or false?
True.
Steroid
decrease. True.
Okay. So you got 1, 2, 3, 4, 5. So 12.5 points. So you got 5 questions correct. So 12.5 points at the end of
KFC
rapid fire.
2.5 below. Preterm 32 weeks.
Anything? Any confusion? Okay. So we'll go on and look at the answers. Heart rate is less than 60, as you mentioned. What is PDHM? It is nothing but pasteurized donor human milk. Lakshya program is actually labor room quality improvement, as you have mentioned. Sucrose 24 is used for analgesia. And weight cutoff is not 2, it's 2.5. Pressure, increase in pressure, and fetal tachycardia, that is true. Antenatal steroids, that also you have mentioned, it's true. So you got 12.5 points at the end of rapid fire. With that, we have come to the end of the quiz. Thank you so much for being patient and sticking on to our rules. All the teams have done very well, starting from the prelims. As Madam rightly mentioned, all were very good, all had scored well. This is just a learning session. So, and I hope all of you and the audience, as well as all of us, got some new information at the end of the quiz. So can I have Nimita on screen? Nimita, are you ready with the score? Or Madam, would you like to take over for a couple of minutes so that Nimita gets the score ready?
നിത്യ പറഞ്ഞതുപോലെ തന്നെ, അതായത് ആദ്യം മുതൽ തന്നെ പ്രിലിംസിന്റെ ഞങ്ങളുടെ റെസ്പോൺസ് കണ്ടപ്പോൾ നമ്മൾ വിചാരിച്ചു ഞങ്ങൾ ക്വസ്റ്റ്യൻസ് തന്നെ മാറ്റിയാലോ എന്ന് വിചാരിച്ചു.
Exactly.
അത്രയും. So your answering to the prelims were excellent. So 6 ടീമിനെ നമ്മൾ സെലക്ട് ചെയ്യണം, അതുകൊണ്ട് മാത്രമാണ് നമ്മൾ സെലക്ട് ചെയ്യുന്നത്. എല്ലാവരും ടൈറ്റ് ആയിരുന്നു. മാർക്സ് ഓൾമോസ്റ്റ് ഹൈ സ്കോർ ട്രിവാൻഡ്രം ആയിരുന്നു. 45 ഔട്ട് ഓഫ് 50 they scored 45. Okay, so anyway, we'll see the answer. Final
luck is actually a very important factor. അപ്പൊ ലക്ക് പ്ലസ് നോളജ് ആണ്. പിന്നെ നമ്മൾ ടൈം ഇത്ര ഷോർട്ട് ആക്കി വെക്കാനുള്ള കാരണം നമുക്ക് വേറെ ഒരു സോഴ്സ് ഒന്നും ആൻസർ വേണ്ട, നമുക്ക് അറിയുന്നത് മാത്രം പറയാ എന്നുള്ളത് ഉറപ്പാക്കാൻ വേണ്ടിയിട്ടാണ് ടൈം ഇത്ര ഷോർട്ട് ആക്കി വെച്ചത്. ഐ നോ ഇറ്റ്സ് വെരി ഡിഫിക്കൽട്ട് ടു ടൈപ്പ് വിത്തിൻ 10 seconds, 10-15 seconds ടൈപ്പ് ചെയ്യാൻ ഡിഫിക്കൽട്ട് ആണെന്ന് അറിയാം. ബട്ട് സ്റ്റിൽ ദേ ഹാവ് ഡൺ വെരി വെൽ, അല്ലേ മാഡം?
യെസ്.
Nimita, are you ready with the score?
And audience also. Audience, and I got answers from Vijayalakshmi, Binduja. They have also so many answers. They also answered correctly.
Very good. Thank you so much, audience. And they were very patient. None of them got
almost last വരെ നമുക്ക് same number of participants meet ചെയ്യാൻ പറ്റി.
If Nimita is ready with the score, I think she can share the screen. Madam?
Yes. Nimita, please share.
So at the end of the quiz, we have Team A with 60 points, Team B with 57.5 points, Team C 45 points, Team D 10 points, Team E 12.5 points, and Team F 40 points. Ma'am, am I audible?
Yeah, thank you so much, Nimita, for the scores. So I would request Phoebe Madam to take over. Madam, please unmute. Madam, please unmute.
Ma'am, should I show the next slide?
Yes, is it ready? Then you can show. If it is ready, yes, you can show. Yeah, thank you so much.
I invite Parvati, VK Parvati ma'am. Ma'am has joined from the starting itself and waiting for whole show. Okay, to announce the scores. Ma'am, please. Parvati madam, please unmute.
So, third position goes. Congratulations to all the participants and the quiz masters, quiz mistresses, I should say. Okay, so the third place goes to Team C, that is Kinder Chertala, and second place goes to Team B, SAT Thiruvananthapuram, and first place goes to Team A, that is Women and Child Psych Corps. Congratulations to the winners, and also the participants. Thank you for calling me. Okay.
We have Dr. Murali Raj. I think Dr. Murali Raj has left. I'll call Dr. Saroja ma'am. Ma'am is working in Jubilee. Ma'am, please say a few words and please encourage our participants.
See, I am very happy to see all the quiz mistresses and those who took part. They were very prompt in answering.
Yes.
And they were a little worried. That's why they went wrong. And I could learn many things. That's the thing I take. I see all the programs because the neonatology has advanced so much. So because of late, I am not used to neonatal things. So I learned many things. Thanks for teaching me, Nitya, Febi, everybody. Thank you.
Participants, please comment.
Oh, third, first.
Participants.
SAT Trivandrum.
Lose between cup and joy.
നന്നായിരുന്നു നിങ്ങളുടെ പെർഫോമൻസ് നന്നായിരുന്നു. പ്രത്യേകിച്ച് നിങ്ങൾ മിസ് ചെയ്തു. അത് ഞങ്ങൾ എക്സ്പെക്ട് ചെയ്തില്ല നിങ്ങൾ മിസ് ചെയ്യും എന്നുള്ളത്.
Actually, it was in a rush.
സാരയില്ല, അതൊക്കെ സംഭവിക്കാൻ കുഴപ്പമില്ല കേട്ടോ. All the best. You have done well.
It's all a learning session. We learn
WNC type card.
new things. That's all.
Yes, ma'am.
So next round will be after between October 15th and November 15th. So in zonal round that will be announced later. Okay, I will send the details to you. Your details and the venue will be sent to you. Okay, so congratulations once again.
Thank you, ma'am.
Kinder Cherthala.
Ma'am.
How was your experience?
ആദ്യമായിട്ടാണ് ഇങ്ങനെ വരുന്നത്. ഭയങ്കര ഹാപ്പി ആയിട്ടുണ്ട്. തേർഡ് പൊസിഷനെങ്കിലും കിട്ടിയതിൽ. പിന്നെ താങ്ക്സ് ടു അവർ ഡോക്ടർ നന്ദൻ. അത് സാർ ഒരുപാട് ഹെൽപ്പ് ചെയ്തിട്ടുണ്ട്. സോ എല്ലാവർക്കും നന്ദി. താങ്ക് യു.
Okay, all the best. Medical Trust. Team Medical Trust.
Yes, ma'am.
Okay, all the best. Okay, you have done well. In the prelims also you have done. Then
Any of the teams want to share something? എന്തെങ്കിലും
ബുദ്ധിമുട്ടുകൾ നേരിട്ടതോ നെക്സ്റ്റ് ടൈം ഞങ്ങൾ എന്തെങ്കിലും ഇംപ്രൂവ് ചെയ്യണമെങ്കിൽ അല്ലെങ്കിൽ നിങ്ങൾക്ക് എന്തെങ്കിലും സജഷൻസ് ഉണ്ടെങ്കിൽ ഷെയർ ചെയ്യാം.
Madam, make it offline next time, please.
Yeah, they want offline. They had a very bad audio. I was worried till the last in the passing round വരെ നിങ്ങൾ ഒച്ച കേട്ടപ്പോഴാണ് സമാധാനമുള്ളൂ. Otherwise, what will you do for rapid fire? We thought. അതെ, we also look forward to ഒരു physical state തന്നെ ക്വിസ് നടത്തണം എന്നുള്ളത് തന്നെയാണ്.
Next year maybe. Okay.
Thank you, madam. But we can't participate. You won't allow us, na?
No. Why?
കഴിഞ്ഞ പ്രാവശ്യത്തെ വിന്നേഴ്സിനെ അല്ലെങ്കിൽ ആരെയും എടുക്കില്ല എന്ന് പറഞ്ഞു.
കഴിഞ്ഞ പ്രാവശ്യം നാഷണൽ വിന്നേഴ്സിനാണ് എടുക്കാത്തത്.
Okay. So we'll be back.
Yeah, definitely. Prepare it.
Thank you.
Madam, I think
we'll wind up.
We'll call
okay,
it
thank you so much. I would like to thank Dr. Nitya from the start. With the energy, with the enthusiasm, she took that time and effort to prepare this quiz. Okay, then I'll thank Nimita, my student, my colleague, for supporting us for the scoring and all the monitoring activities. And also I would like to congratulate and thank all the participants. So നമ്മൾ പറഞ്ഞപ്പോൾ തന്നെ നിങ്ങൾ മോക്കിന് റെഡിയായി, പ്രിലിംസിന് കറക്റ്റ് ടൈം ലോഗിൻ ചെയ്തു, അതുപോലെ എല്ലാത്തിനും നമ്മൾ സപ്പോർട്ട് ചെയ്തു, കറക്റ്റുള്ള റാപ്പിഡ് റെസ്പോൺസ് ആയിരുന്നു. So thank you so much all the participants and all the team members, and also I would like to thank all the pediatricians and neonatologists in the support there to support them, because നിങ്ങളുടെ നമുക്ക് റെസ്പോൺസ് കാണുമ്പോൾ അറിയാൻ പറ്റും നിങ്ങൾക്ക് എത്രമാത്രം നോളേജ് നിങ്ങളുടെ ടീം, അതായത് പീഡിയാട്രിക് ഇൻക്ലൂഡിങ് നിങ്ങളുടെ ടീം മെമ്പേഴ്സ്, ഡോക്ടേഴ്സ് ആയിക്കോട്ടെ, ബാക്കിയുള്ള ടീം മെമ്പേഴ്സ് നിങ്ങൾക്ക് പ്രൊവൈഡ് ചെയ്തിട്ടുണ്ടെന്നുള്ളത്. നമ്മൾ ഉദ്ദേശിച്ചത് ഇതൊരു ക്യൂസ് തിയറി മാത്രമല്ല, നമ്മളിവിടെ പഠിപ്പിച്ച കാര്യങ്ങൾ നിങ്ങളുടെ പ്രാക്ടിക്കൽ, നിങ്ങളുടെ ഐസിയുവിൽ നിങ്ങൾക്ക് എത്രമാത്രം ഉപയോഗപ്പെടാമെന്നുള്ളതാണ് ഞങ്ങൾ ആലോചിച്ചത്. അപ്പൊ കുറച്ച് ചില ഏരിയാസിൽ ടഫ് ക്വസ്റ്റ്യൻസ് ഉണ്ടായിരുന്നു ഞങ്ങൾക്ക് അറിയാം, പക്ഷെ എങ്കിലും അത് പ്രാക്ടിക്കലി യൂസ്ഫുൾ ആയിട്ടുള്ള ക്വസ്റ്റ്യൻസ് ആയിരുന്നു. സോ ഓൾ ദ ബെസ്റ്റ്, all the team participants, and also I would like to thank all the audience to join us for encouraging all the teams. Thank you so much.
Thank you, ma'am. Thank
Nitya?
you, everyone.
Thank you.
Thank you all.
Thank
So shall we wind up?
Sure, ma'am.
Thank you. Thank you, Nivida.
Okay, madam. ഷാലു എന്റെ കൂടെ ഉണ്ടായിരുന്നു മാഡം.
ആണോ? എവിടെ കണ്ടില്ല, പറഞ്ഞില്ലല്ലോ.
ഇവിടെ ഉണ്ട്.
താങ്ക് യു. കൃത്യമായിട്ട് ഞാൻ വിചാരിച്ചു നിവിതയ്ക്ക് ടെൻഷൻ ആയോന്ന്, അവസാനം കാൽക്കുലേഷൻ വന്നപ്പോ. കുഴപ്പമുണ്ടായിരുന്നില്ലല്ലോ അല്ലേ?
ഇല്ല ഇല്ല മാഡം.
ശരി, താങ്ക് യു കേട്ടോ. താങ്ക് യു ശാലു.
താങ്ക് യു മാഡം.